Hey everyone, welcome back to The Explainer. Today, we're systematically demystifying a deeply personal and medically complex topic, the causes of subfertility. If you or someone you know has ever found themselves totally lost in a sea of medical jargon, wondering what exactly causes difficulties in conceiving, you are absolutely in the right place. We're taking the guesswork out of the equation and relying strictly on the clinical data. Let's get started.
Okay, let's dive into this. Here's our roadmap for today. We'll start with the 30-30-30-10 rule, then explore female causes spanning the tubes, ovaries, uterus, and cervix. After that, we'll shift gears to male causes, looking at sperm quality, lifestyle, and anatomy, before finally opening up the unexplained Pandora's box.
All right, Section 1, the 30-30-30-10 rule. Now, what's really interesting about this breakdown is how it completely shatters a massive, honestly unhelpful stigma. Historically, people have treated fertility like it's largely a female issue, but the clinical data proves that is just not true, and we need to address that right out of the gate. The causes of subfertility are actually perfectly split. 30% are strictly female causes, 30% are strictly male causes, and another 30% are a combination of both. It's a completely equal distribution of diagnosed medical factors. That remaining 10% falls into the unexplained category, which we'll unpack at the end. But seeing it laid out like this radically shifts how we should think about reproductive health. It's a shared physiological equation.
Moving on to Section 2, female causes, tubes, and ovaries. Let's look at the upper reproductive tract.
Tubal disease and blockages are absolutely massive factors globally. Actually, the data notes this is the single most common cause of subfertility in Nigeria. But, what's actually causing these blockages? Most often, it's linked to previous or chronic pelvic inflammatory disease, or PID, which usually originates from infections like gonorrhea and chlamydia. When PID becomes chronic, it can lead to severe uterine scarring, known as Asherman syndrome. Other culprits include complications from medical procedures, general surgical scarring, and endometriosis. Simply put, if the physical pathway for the egg and sperm to meet is literally blocked by a scar or infection, conception just can't happen.
So, moving down to the ovaries. Ovulatory disorders are the second most common female factor. But how do you actually know if you have one? Well, the clinical indicators are oligomenorrhea, which is just the medical term for really infrequent periods, and amenorrhea, the complete absence of periods. If the menstrual cycle is irregular or missing, it's a major biological red flag that the ovary isn't releasing an egg reliably. And, well, no egg, no conception.
So what's actually triggering these ovulatory failures? By far, the most common culprit is PCOS, or polycystic ovary syndrome. But beyond that, it's kind of wild to see how incredibly sensitive the reproductive system is to our overall systemic health. Thyroid disorders, mostly hypothyroidism, can totally throw the cycle off. Obesity is a major player, but then on the flip side, excessive, super strenuous physical activity can literally shut ovulation down too. Throw in certain medications and the heavy physiological toll of stress, and you can really see how delicate this whole ovulatory balance is.
All right, Section 3, female causes, uterus, and cervix. Let's travel a bit further down the reproductive tract. Before we look at the shape of the uterus itself, let's pause for a second to bust some jargon around a condition you've probably heard of, endometriosis. Clinically speaking, this is when endometrial tissue, the lining of the uterus, grows completely outside of its normal home. We're talking on the ovaries, the pelvic peritoneum, the bowel, even the bladder. And this stray tissue is incredibly disruptive. It physically causes scarring and cysts, but beyond that, it triggers immunological reactions that basically create a super hostile environment for fertility.
And this brilliantly illustrates another really common physical disruption, fibroids. These are benign, non-cancerous growths inside the uterus. Now, while they're super common, their physical footprint is what dictates the problem. It boils down to three things. First, the size of the fibroids. Second, how many there are. And third, and perhaps most importantly, their location. If a fibroid is physically protruding right into the uterine cavity, it's literally taking up the physical space an embryo needs to implant and grow.
To wrap up the female factors, we've got structural and cervical hurdles. Some of these you're born with, like a heart shaped by corny wet uterus or a uterine septum. Inside the uterus, things like polyps or scarring from Asherman syndrome act as literal roadblocks. And moving down to the cervix, severe scarring or narrowing from past surgeries can just block sperm from entering altogether. Plus, an infection like cervicitis or the presence of anti-sperm antibodies can create this hostile cervical mucus.
So instead of helping the sperm travel, the mucus actively fights them off. Okay, Section 4. Male causes and sperm quality. Let's zoom way in to the microscopic level.
Now we're shifting the narrative weight fully over to the male side. 15 million? It sounds like a massive number, right? But when it comes to human reproduction, it's actually the bare minimum. The clinical data shows that anything under 15 million sperm per milliliter is officially classified as a low sperm count. It just really puts into perspective the staggering biological scale required for natural conception.
Let's move to this matrix and see how this builds, because if you've ever stared at a semen analysis report, it honestly looks like a foreign language. Let's translate. Oligozoospermia, that just means a low sperm count. That's our sub-15 million threshold. Asthenozoospermia is poor motility, meaning less than 32% of the sperm are actually moving progressively forward like they should. Teratozospermia means abnormal morphology, where less than 4% have a normal physical shape. And finally, leukocytospermia means there's an active infection marked by white blood cells. Any single one of these, or a mix of them, dramatically drops the odds of conception.
Section 5. Male causes related to lifestyle and anatomy. Let's zoom back out to the macro level.
Beyond just the cellular quality, there are major structural and functional hurdles for men too. This includes erectile dysfunction, which the data notes is often secondary to underlying systemic diseases like diabetes. Then you have ejaculatory disorders, like premature or retrograde ejaculation, where the fluid actually goes backward into the bladder instead of out. There are also congenital penile abnormalities, physical conditions a guy is born with, like hypospadias or Peyronie's disease, that can physically get in the way of the reproductive process.
Now, it is absolutely crucial to recognize the overlap of lifestyle impacts here. Just like female fertility is heavily impacted by obesity and stress, we see the exact same universal adversaries on the male side. But for men, we also have to factor in the heavily documented impacts of smoking, excessive alcohol consumption, and drug abuse. It paints a really clear picture. Environmental and lifestyle stressors do not discriminate. They aggressively target both reproductive systems.
Finally, Section 6. The unexplained Pandora's box, that mysterious final 10%. So, we've covered the female, the male, and the combined causes. That leaves us with the most mysterious 10%. The clinical source text has this great quote. It is a Pandora's box, and that there is a plethora of disorders within this terminology. So the absolutely crucial point here is this. Unexplained does not mean there's no cause. Unexplained really just means undiagnosed. Inside this box is a chaotic mix of highly complex immunological, physiological, and endocrine problems that our standard tests just aren't sensitive enough to catch yet. And heavily intertwined in all of this, once again, is the elusive, hard-to-measure impact of deep psychological and physiological stress.
Which brings us to a really fascinating conclusion. We've mapped out the physical, the cellular, and the structural causes that modern medicine can easily spot. But if unexplained simply means undiagnosed, what future medical breakthroughs will finally let us look deep inside that Pandora's box? I mean, what microimmunological tests or genetic screenings are waiting right over the horizon to turn that mysterious 10% into actionable, treatable data? That right there is the bleeding edge of reproductive medicine, and it is an incredibly exciting frontier. Thank you so much for joining me on this explainer. Stay curious, keep seeking the facts, and I'll catch you on the next one.